Okay, so now we are going to discuss another interesting chapter, that is leukemia and lymphoma, right? So now we are going to discuss about another interesting chapter, leukemia and lymphoma. So in simple words, first we have to understand what is leukemia, what is lymphoma, and what is the difference between these two, right? So what are these leukemia and lymphoma? Overall, when you study about them, it means these are the tumor of immature white blood cells, right? So these are the, in simple words, I am telling you, tumor of immature white blood cells. So tumor of white blood cells or immature white blood cells, when they involve peripheral blood or bone marrow, they are called as leukemia. So that is important. To say leukemia, what we should understand, they will be involving peripheral blood or bone marrow. So when they are involving bone marrow or peripheral blood, these are considered as leukemia. So what is the difference between leukemia and lymphoma? Tumor of immature white blood cells involving peripheral blood or bone marrow, they are called as leukemia. And when they involve lymph node or organs, they are called as lymphoma, right? So that is the another important point we need to remember, right? So when they involve lymph node or organs, they are called as lymphoma. So that is the basic difference. It's a tumor of WBC. When they involve peripheral blood or bone marrow, they are called as leukemia. It's a tumor of WBC. When they involve lymph node or organs, they are called as lymphoma, right? So now the question is, can leukemia have a lymphoma form in the same patient? Can lymphoma have leukemic form in the same patient? And that was the question in All India and AIIMS exam, right? So that is a true statement. Every leukemia may have lymphoma or every lymphoma may have leukemic form, right? So that is a true statement. It's a simple rule of metastasis. Just imagine, it's a simple rule of metastasis. When tumor cell load is more in peripheral blood, where they will go? They will go to the lymph node or organs. Same way, whenever there is a more load in bone marrow, where they will go? In lymph node or organs. Similarly, whenever lymph node or organ is having more tumor load, where they will go? They will go to the peripheral blood or bone marrow. So that is why it is very wiseful to say that leukemia may have lymphoma form, right? So we should understand that a statement given in AIIMS exam was a absolutely true statement. That statement was leukemia may have lymphoma, right? So leukemia may have lymphoma phase. So that was the statement given in exam. So that was a true statement, right? So leukemia may have lymphoma and vice versa, right? So this point we have to keep in mind. This was the statement in AIIMS exam. So every leukemia may have lymphoma, lymphoma may have leukemia. Simple rule of metastasis. Whenever tumor load will be more in peripheral blood or bone marrow, where they will go? They will go to the lymph node or organs. And whenever tumor load is more in lymph node and organ, where they will go? They will go to the peripheral blood and the bone marrow. So that is why leukemia may have lymphoma and vice versa. Statement was a absolutely correct statement, right? Now the second thing we have to understand is at present which classification we are following for the leukemia and lymphoma, right? So at present we are following WHO classification. So at present we are following WHO classification, right? So what is the WHO classification? In simple words, first, for understanding point of view, I am going to tell you, in WHO classification we divide the tumors as a Hodgkin's lymphoma, right? Hodgkin's lymphoma, HL stands for Hodgkin's lymphoma, right? So there is number one, Hodgkin's lymphoma, and then we divide non-Hodgkin's lymphoma, NHL, non-Hodgkin's lymphoma, NHL. Hodgkin's versus non-Hodgkin's lymphoma, right? So in non-Hodgkin's lymphoma, further we divide tumors like this. NHL we can divide them into B cell and T cell type of tumor, right? So we can divide them into B cell and T cell type of tumor. So B cell and T cell type of non-Hodgkin's lymphoma. Then we divide further B cell into two types, right? One will be the immature B cell. One will be immature B cell, and second group will be with mature B cell, right? So mature tumor, mature cell tumor, immature cell tumor. So in immature cell tumor, what are the names we are going to include? It is called precursor, because they will be having pre-B cells, right? So they will be having bone marrow. Bone marrow is having pre-B cells, right? So these are pre-B cell type of leukemia, right? So pre-B cell type of leukemia or lymphoma. So pre-B cell type of leukemia or lymphoma, this will be the immature. Mature will be called as peripheral B cell type of leukemia lymphoma. So mature will be called as peripheral B cell type of neoplasm. So peripheral B cell type of neoplasm, this will be called as peripheral B cell type of neoplasm. So this is how we are dividing B cell into immature and mature, right? Same way, T cell is also classified into immature and mature. So now here also we are going to see that T cell is also divided into immature and mature. Immature T cell, and immature T cell is called as precursor T cell type of neoplasm, right? So precursor T cell type of neoplasm will be having precursor T cell type of ALL or AML, right? And here you will see mature T cell. Mature T cell will be called as peripheral T cell type of neoplasm, right? So peripheral T cell type of neoplasm. So this is how we are dividing non-Hodgkin's lymphoma into immature and mature, right? Immature pre-B ALL. So here I am giving you example. Immature example I am writing here. It is pre-B type of ALL, right? Pre-B type of ALL. Mature B cell lymphoma. Mature B cell lymphoma. What are the example of the mature B cell lymphoma? So I am just writing some of them. For example, I will write number one is the mantle cell lymphoma, right? So mantle cell lymphoma is a B cell. So these are all B cell type of lymphoma. Mantle cell lymphoma, right? Then CLL, chronic lymphocytic leukemia or small lymphocytic lymphoma, or follicular lymphoma, right? Follicular lymphoma. So these are the examples of the B cell, follicular lymphoma, DLBL, all these are B cell type of lymphoma. Immature pre-T cell. So immature pre-T cell, we can write pre-T type of ALL, right? So pre-T type of ALL will be example of the immature precursor T type of ALL. Mature peripheral T cell type of leukemia lymphoma. What are the example? Here we can remember the example of mycosis fungoides, right? So mycosis fungoides, anaplastic large cell lymphoma, right? Then another example will be anaplastic large cell lymphoma. Anaplastic large cell lymphoma, right? So these are the T cell type of lymphoma: mycosis fungoid, anaplastic large cell lymphoma, enteropathy associated T cell lymphoma, right? So this, which is seen in celiac sprue, that is called enteropathy associated T cell lymphoma, right? So it is enteropathy associated T cell type of lymphoma. So this is how we are classifying the T cell, right? So it's just a superficial classification for understanding, right? So I have made it just for the understanding. Okay, non-Hodgkin's lymphoma. Now you can see non-Hodgkin's lymphoma, I have divided B cell and T cell type. B cell immature, mature. Immature is precursor B cell type of lymphoma, and mature is precursor peripheral B cell neoplasm, right? And these are the examples. Same way, T cell immature is called precursor T cell and mature is called peripheral T cell neoplasm. So that is how we divide them. That is how we will divide them, and we will try to remember them who are the mature, immature, or B cell or T cell type of lymphoma, right? So you again see how we started WHO classification. WHO classification which we follow right now, we are dividing lymphoma into Hodgkin's versus non-Hodgkin's lymphoma, right? Now we will see what is the cells of origin for all these lymphomas. Now we are going to discuss about cells of origin, right? So now we are going to discuss about cells of origin for all these lymphoma and leukemia. Remember, this cells of origin of this leukemia lymphoma was the question in previous year AIMS exam, right? That question was about CLL. What is the cell of origin? And answer was naive B cell, right? So now we are going to see that how we can remember them, right? So as I have told you, there are two type of neoplasm, right? B cell type of neoplasm means B cell type of leukemia, B cell type of leukemia, and second is the T cell type of leukemia or lymphoma. So B cell type and T cell type of neoplasm. So now we are going to see the origin of B cell and T cell. So where is the site of origin and maturation for the B cell? It is from the bone marrow, right? So it is from the bone marrow. So I am making a representative diagram of the bone marrow. So this is the bone marrow, right? Bone marrow. So for B cell, I am going to show you the bone marrow. In bone marrow, there are three important precursor cells we need to remember, or immature cells we need to remember. Number one is called common lymphoid progenitor cell. Number one is called common lymphoid progenitor cells. So common lymphoid progenitor cells are present in B cell development, right? So first from the stem cells, there will be formation of common lymphoid progenitor cell. From common lymphoid progenitor cells, there will be formation of precursor B cell. So now they will be forming precursor B cell. From precursor B cell, they will be forming naive B cell, right? So these are the three important things which we need to remember, right? So these are the three important things. Number one is the common lymphoid progenitor, second is the precursor B cell, and third one is the naive B cell, right? So common lymphoid progenitor cells, which type of tumor you will see. So now we are going to see what are the tumor going to arise from the precursor B cell. So precursor B cell will be giving rise to a tumor which is called as precursor B cell type of ALL, right? So this will be called as precursor B cell type of ALL. So this will be arising from the precursor B cell. So this point we have to keep in mind, precursor B cell type of acute lymphoblastic leukemia or lymphoma will be arising from the precursor B cell. Which tumor will arise from the naive B cell? And that was the question in AIMS exam. Naive B cells, there will be origin of chronic lymphocytic leukemia or small lymphocytic lymphoma, right? So CLL or SLL will be arising from the naive B cell, and this was the question in AIMS exam. So CLL, SLL will be arising from the naive B cell. So that was the question in AIMS exam previous year, right? So origin of CLL, SLL is from the naive B cell. Coming to the T cells, right? So what is the, B cell origin was and maturation was in bone marrow. Now we are going to see about T cell. What will be origin and maturation in T cell? So look at the T cells. T cells, their maturation will happen in thymus. So this will happen in thymus. So I am making a rough diagram for understanding. This is the thymus, right? So I had drawn this diagram, a representative diagram for thymus. In thymus, what will happen? This T cell will enter and they will be forming, initially they will be forming CD4 minus and CD8 minus type of T cells. Then they will be forming CD4 plus and CD8 plus type of T cells, right? So this is how there are two immature type of T cells will be formed. 4 minus, 8 minus, and then 4 plus, 8 plus will be present. right? So these two things which had been formed here, they both will be forming precursor T cell type of acute lymphoblastic leukemia or lymphoma. So that is the important thing we have to keep in mind, right? So precursor T cell type of ALL will be formed by both CD4 minus 8 minus and CD4 plus 8 plus T cells, right? So these T cells which has been formed in thymus, they will be forming, or they will be giving rise to precursor T cell type of ALL. Now they will reach to the lymph node, right? So now what will happen inside the lymph node? So here I am going to encompass the entire lymph node. This is again a schematic diagram for the lymph node, right? So I'm just making a schematic diagram for the lymph node, right? So this is the lymph node, right? So what I'm going to show you now, it is the lymph node, right? So this is the lymph node, right? In the lymph node there are 3 zones, right? So remember, in any lymph node there are 3 zones. Number 1 is called, and the inner one is called germinal center, right? So inner one is called germinal center. After germinal center there will be outer zone which is called as mantle zone. This is called mantle cell layer, right? So mantle zone, right? And outside at the margin they will be having another zone which is called as marginal zone, right? So this is called as marginal zone. So these are the 3 zones: germinal center, mantle zone, marginal zone, right? So this is the order: inner one, germinal, followed by mantle, then marginal zone will be present, and these all zones will be giving rise to a special type of tumors, right? So now we are going to see when B cell will enter in the development. So what will happen when they are present in marginal zone? Which type of tumor will arise? From mantle, which tumor will be arising? From germinal center, which tumor will be arising, right? So now we are going to see these 3 things, right? So in the lymph node, what I am showing you here, from the marginal zone which type of tumor will be arising, right? So now we can see that from the marginal zone, see this, from the marginal zone, which tumor you will see? So number 1, the name itself is the marginal zone B cell lymphoma. So marginal zone B cell lymphoma, DLBL, diffuse large B cell lymphoma. So diffuse large B cell lymphoma will be arising from the marginal zone of the lymph node. And third one, we need to remember, even CLL or SLL in the lymph node, origin will be from the marginal zone of the lymph node. So these are the 3 basic tumors which we need to remember for future exam point of view, right? Marginal zone B cell lymphoma, then second is the diffuse large B cell lymphoma, and third one is CLL SLL. So these are the 3 tumors which will be arising from the marginal zone of the lymph node. Which tumor will be arising from the mantle zone? So it's a simple, mantle zone will be giving rise to mantle cell lymphoma, right? So that name itself is arising mantle cell lymphoma, right? From the germinal center there will be formation of the plasma cells, right? So we have to remember that from the germinal center there will be formation of the plasma cells, and from the germinal center which tumor will be arising? Now the question is, from the germinal center which tumor will be arising? Germinal center will be giving rise to multiple myeloma, then second, which is important here, is follicular lymphoma. Germinal center, follicular lymphoma. So multiple myeloma, follicular lymphoma, they will arise from the germinal center, right? So what are other important tumors which will arise from the germinal center, which we have to keep in our mind for future exam point of view? So from the germinal center we can see there may be another tumor which is interesting one, which examiner asks in exam, is the Burkitt's lymphoma, right? So Burkitt's lymphoma also arises from the germinal center. right? Fourth one is the diffuse large B cell lymphoma. So now you can see that DLBL can be arising from the germinal center also, and they can arise from the mantle marginal center also, right? So marginal zone also we are seeing DLBL, and now we are seeing DLBL with the germinal center origin also, right? One interesting point we need to remember, which is atypical and can be a future question, that is the Hodgkin's lymphoma. Because usually Hodgkin's lymphoma do not arise from the germinal center. They do not arise from the germinal center, right? But there is a one variant of the Hodgkin's lymphoma, one subtype. And what is that subtype? That is the lymphocyte predominant. Lymphocyte predominant type of Hodgkin's lymphoma. So this point we need to keep in mind. Not all Hodgkin's lymphoma, only lymphocyte predominant will be arising from the germinal center. So this is how we can see origin of these tumors, right? So these are the all B cell tumors. So whatever I have written, these are all B cell tumor from the lymph node. Now from the thymus, when T cell will enter inside the lymph node. So see here, I'm making the same thing here. Again, I'm making the same thing, 3 zones, right? Just for understanding, I'm making the 3 zones. This was the germinal center, then this was the mantle cell zone, and then followed by marginal zone, right? So when T cell will enter into the lymph node, they will be giving rise to peripheral T cell type of leukemia or lymphoma, right? So peripheral T cell type of leukemia or lymphoma will be given by them, right? So that is how we can remember all these things together, right? So cells of origin is very important and conceptual point, so that we should understand, because it gives a salient feature of the lymph node centers and their origin, right? For example, germinal center, all these tumor, multiple myeloma, follicular lymphoma, Burkitt lymphoma, DLBL, Hodgkin's lymphoma, which variety? Lymphocyte predominant. Marginal zone B cell, DLBL, CLL, right? Mantle zone, mantle cell lymphoma. Same way, when examiner will ask you this question in your exam, in future exam, so we should be very, very thorough with all these things. Okay, who will be arising from the bone marrow or who will be arising from the thymus, and this diagram will help you to understand in your exam, right? So now you can see that naive B cell is CLL. That was the question, right? So that was the question in AIMS exam. Naive B cell is the cell of origin for the CLL or SLL in the bone marrow, right? So that was the question. So that is why I wanted to discuss this cell of origin of this leukemia and lymphoma, right? Now we are going to discuss about some of the basics differences. Okay, what are the differences between Hodgkin's lymphoma versus non-Hodgkin's lymphoma? So Hodgkin's lymphoma versus non-Hodgkin's lymphoma, what are the differences, right? Hodgkin's lymphoma, usually they involve single group of lymph nodes, right? Where they may involve chain of lymph nodes. Mostly Hodgkin's lymphoma is nodal. That is why they are called as nodal, because lymph node involvement is very common, right? Lymph node involvement is very common. That is why Hodgkin's lymphoma is considered as nodal. Whereas lymph node involvement is rare, and that is why they are called as extranodal. Organ involvement will be more common. In case of non-Hodgkin's lymphoma, extranodal, right? So this lymph node involvement in Hodgkin's lymphoma is characteristic, orderly spread in contiguity. So this lymph node involvement is orderly spread in contiguity, right? So what is the meaning of in contiguity? Orderly spread means they will involve the lymph node in an order, right? So they will be following order like cervical lymph node, then axillary, then mediastinal. Like that, they will be involving group of lymph nodes. In contiguity means when they will involve lymph nodes. Suppose these are the 4 cervical lymph node, right? So they will be contiguity means nearby. Contiguity means nearby or neighborhood. So they will be, the tumor mass will be involving like this. Suppose this blue color I'm showing you, this is the tumor mass, right? This is the Hodgkin's lymphoma. So Hodgkin's lymphoma will never go directly and involve this lymph node. They will be involving in contiguity, means next this one, then next this one, and then next this one. So that is the meaning of in contiguity. So they are involving the neighborhood lymph node. So this is how they will be involving, orderly spread in contiguity, whereas there is no orderly involvement, right? So there is no order in case of the non-Hodgkin's lymphoma. So no orderly spread in case of non-Hodgkin's lymphoma, right? So that is the basic difference between Hodgkin's and non-Hodgkin's. Young patient will be given in your history, or patient will be young and he will be having orderly involvement of the lymph node. First thought in your OPD will strike of Hodgkin's lymphoma, right? So orderly spread, if you are seeing through the scan report or through the other report or through other MRI report, then you should think about Hodgkin's lymphoma. But what we need to understand, there are two group of lymph nodes which are exception, which will be rarely affected in Hodgkin's but commonly affected in the non-Hodgkin's. What are those two exceptions of the lymph node? Mesenteric and Waldeyer ring of the pharynx, right? So we need to understand that mesenteric lymph nodes. So here we have to understand mesenteric lymph nodes and Waldeyer ring, right? So mesenteric lymph node and Waldeyer ring, which is the lymphatics present in the pharynx, they are commonly affected in case of non-Hodgkin's lymphoma and rarely affected. So I am writing rarely by 1 plus only. Rarely affected in case of Hodgkin's lymphoma. So that is very important point to understand. Whenever you are seeing a young patient coming to your OPD and his scan report is revealing about mesenteric lymph node or Waldeyer ring, that time first thought in your mind should be of the non-Hodgkin's lymphoma. So why I am saying like this? Because when we started discussion, we said like this, कि Hodgkin's lymphoma is mostly nodal and non-Hodgkin's is mostly extranodal. So this exception we have to keep in mind. And what are these exceptions? These are the mesenteric lymph nodes and Waldeyer ring. Mesenteric lymph node and Waldeyer ring most commonly affected in non-Hodgkin's lymphoma and rarely affected in case of the Hodgkin's lymphoma. So that point we have to keep in mind whenever we are practicing in our OPD and wherever we are dealing with a patient with mesenteric or Waldeyer ring knowledge, ki Waldeyer ring or mesenteric lymph node is affected, right? So that time we have to think about non-Hodgkin's lymphoma.